Yes, so the Qualified Health Information Organization, or the QHIO program, is one of the tenets of this statewide data exchange framework initiative that's really designed to facilitate the sharing of data across the entire state through data intermediaries. So what this means is that the QHIOs will serve as a network of networks, meaning that these qualified organizations are agreeing to connect to one another and to, play in the same sandbox together to ensure statewide connectivity. Why this is important is that, with this QHIO network, we can be sure that critical information is able to be shared and accessed across the entire state. So if I live in Southern California, but I'm visiting family in Northern California and end up in the emergency department, the QHIO connectivity behind the scenes enables that critical information to help my providers at the time of care access what they need about me and my health history. It's not required to connect to a QHIO if you sign the data sharing agreement, but it does ensure that an organization is prepared to meet all of those data sharing agreement obligations. So if you select this grant option, you first would work with the California Association of HIEs, QHIE, to support filling out the application and identifying which QHIO might make the most sense for your organization. In a minute, I'll list out the different organizations that have been designated as qualified health information organizations. And in the coming weeks, additional information will be shared from the state regarding these QHIOs, their geographic reach, the markets they serve, and other details that might be important for making your organization's decision. If you don't feel ready to select one of these organizations specifically in your application, but you know that you do want to connect to a QHIO, leaving the specific organization name blank right now is an option. You don't have to fill in one of these names on your application. If you, for example, want to have some additional conversations with your partners, or you want to be sure that locally you're connecting to a QHIO that other entities in your county or city are connecting to as well, you can leave that field blank when working through your DSA signatory grant application with QHIO. You will have to choose at a later date, though. So the QHIO list includes 9 organizations. This was just recently released by California HHS in October of 2023 after they held a QHIO application process. And the 9 organizations, which are listed on the screen here, are 1, Applied Research Works, 2, Health Gorilla, 3, Long Health, 4, Los Angeles Network for Enhanced Services, commonly known as LANES, 5, Manifest MedEx, 6, Orange County Partners in Health, Health Information Exchange, 7, SacValley MedShare, 8, San Diego Health Connect, and 9, Serving Communities Health Information Organization, or SCHIO. So if you're interested in selecting the QHIO onboarding grant under the DSA signatory grants, you can look at this list of 9 organizations, talk to QHIO, talk to your partners, and figure out who it may make most sense for you to connect with. You can find more information on California's data exchange framework at familydocs.org/DXF.